to Health Matters on Channels Television. Thanks for joining us. I am Mary Alale Yusuf. Contrary to what many think, children can suffer from mental disorders. Attention deficit hyperactivity disorder, ADHD for short, is one of the most common neurodevelopmental disorders of childhood. It is usually first diagnosed in childhood and often lasts into adulthood. Children with ADHD may have trouble paying attention. From various studies, statistics of ADHD prevalence vary from as low as 2% to as high as 17%. And boys are 2 to 3 times more likely to have ADHD of the hyperactive or combined type than girls. Many parents of children with ADHD experienced the symptoms when they were younger. My guest is a consultant psychiatrist at the Federal Neuropsychiatric Hospital, Yaba, Dr. Naya Egebara. You're welcome to the show.
Thank you. Thanks for having me.
Now, it's pretty obvious from the name, attention deficit hyperactivity disorder, that there's something there about attention and there's something there about activity or too much activity that is a problem. Now, most parents would say, big deal, all our children are like that, all my children are like that. So what really are the distinguishing factors of ADHD that make you so sure it's not a normal child?
All right. From your introduction, you rightly said it. It's a chronic neurodevelopmental disorder. What that just means is chronic because it lasts for years. From childhood, it can last on to adulthood. And it's a neurodevelopmental disorder because there's a part of the brain that is affected. And that is the part of the brain that has to do with executive function.
Okay.
As we go along, probably I'll get the opportunity to explain, what the executive functioning really is. But it's a part of the brain that helps one to be able to function optimally. So in a child who is having ADHD, there are these 3 cardinal symptoms. There is the inattention.
Okay.
So because there is inattention, they have a very short attention span. They're unable to focus long enough to be able to complete activities. So they may start different activities, abandon one, get onto the other, never completing any. So they come off as being quite disorganized.
There are some adults like that.
Yeah. So besides the inattention, there is also the impulsivity aspect of it. So they take actions without thinking it through. All right. So planning is quite poor. That manifests as that. And so they see that they're very intrusive, they interject when people are doing things. Then there is the hyperactivity, so they are seem to be always in motion. Either they're jumping up all over the place or they are running around all over the place, irrespective of where they are. They could be in a school where everyone is supposed to be seated quietly, and to them it's a whole field of playground to run up and down.
Wow.
So those are the 3 cardinal symptoms. And from there, we have 3 subtypes where there could be predominantly the inattention one in about 18% of cases. There could be predominantly the one with impulsivity or hyperactivity, which is in about 8% of the cases. Then there's a combined one, which is more common in up to 70% of cases.
And boys have that more?
More. The ratio is about 3 to 1. 3 for boys, 1 to girls, but the thing about these symptoms is that they are inappropriate for age. So there is a certain level of playfulness, of hyperactivity that is expected from children. But in this case, it's obvious that this is over the top. Beyond that, you find that it's lasting for more than 6 months, continuously. And it is seen in up to 2 settings, 2 different settings. For example, you observe these symptoms at home, the teachers also observe it in school.
Oh, now you're really giving this perspective.
Yeah, so if you just see some of this hyperactivity, inattention at home, it may be that you want, what's going on in the house that triggers this behavior? Is it the child is being overpampered, is being naughty, would not want to sit in a place? If it's just in one place. If it's just in the school that it's seen, you'd want to find out what's going on in the school that triggers this sort of behavior. Whereas in another setting, the child is calm and is like another regular child. But when you see it occurring continuously in up to 2 different settings and is interfering with normal functioning,
like schoolwork,
like being productive, like completing tasks.
Okay, so this kind of person will put soap on the plates and won't rinse the dishes.
Wouldn't finish up. They could just take up one, they leave it there onto another thing, you know. But the thing is that their hyperactivity most of the time isn't even goal-directed. A lot of times.
Okay, not goal-directed.
Yes.
Okay, we know that it's hereditary from studies. Are there any other risk factors?
Well, there is no one particular thing that one could say, okay, once this happens, then the likelihood of having ADHD is there. But of course, it's obviously genetic disorder, meaning that it could run in family. So if there's a close family member who has had it, the risk of another family member having it is there. Not necessarily
so people can have a whole set of ADHD-affected children?
No. So that was what I was going to correct. That doesn't mean that when a child has it, then other children are likely going to have it, but the risk is there. That's just the thing. And then other things like viral infections during pregnancy, exposure to smoking, exposure to alcohol, you know, when the child was still in the womb, those sort of things.
There are risk factors.
There are risk factors.
But is there any reason? Is there any reason one can hold on to, point to, that actually is the cause?
Just that, you know, when the child is developing in a condition that is not optimal, you know, the development of certain organs can be affected. So in as much as possible, you know, one should attend antenatal care and have infections and all of those things addressed and treated in a timely manner. You know, and, you know, I mentioned that the part of the brain that is mostly implicated is the frontal lobe. You know, the brain has different lobes, but the frontal lobe, precisely the prefrontal cortex, you know, forget about the big grammar.
Involved in this,
is involved.
Maybe underdevelopment or whatever it
is not functioning optimally. And that's the part of the brain that takes care of the executive functions. And I talked about how executive functioning is so vital to one's optimal day-to-day productivity. So this executive function, is a word that people throw around, but maybe for the benefit of those who do not really understand what it entails, I'll go further to explain. So this is a part of the brain that helps one with self-control. Okay, so now you feel like doing something, but the
know that this is not the
right.
place I should do
this is not the
this
place.
Kind of thing.
So you can control yourself until a more appropriate time. But in children with ADHD, you know, they're so impulsive, they don't think through, they just act. So you find them throwing tantrums a lot, and, you know.
Do they hurt themselves? Do they come to harm?
Not intentionally, but in the course of all the hyperactivity, they could come to harm.
And they could be a bit, because I'm seeing somebody now, you know, I know a little boy, and you can't get him to sit still. And he can be quite destructive.
Okay.
Then when you're trying to instruct, it's like he's not there. Could that be ADHD? Like his mind is off somewhere, and, you know, he's off on a mission, and he's not listening to you?
Okay, so such a child will require full assessment by a professional to be able to, you know, make that diagnosis. You know, but if I may just finish up with what the executive functioning is about. Besides the self-control, you also have adaptability in thinking. So you should be able to, like, see other people's perspective on things, adapt to whatever situation that you have around you. Time management is also part of the executive functioning that regular individuals have, that being able to organize, plan, prioritize activities, self-monitoring, being able to monitor yourself, how far have you gone with certain tasks, you know, emotional control, those sort of things. So this part of the brain that deals with executive functioning is not functioning optimally due to poor development of that area. So the hormones that should help regulate these activities are not being produced in sufficient amount to be able to regulate these different behaviors. And so you see all of that,
That's
coming to play.
dopamine again.
Dopamine and norepinephrine.
Can you just inject it into these children and let them function optimally?
Well, the mode of release is not by injecting it, but there are medications which can only be prescribed by professionals who have assessed the child and seen the need for it. And there are guidelines for use of such medications.
Okay, so this is the treatment mode. Does this make the child just like other children when they take these medications?
Yes, they respond very well, with these medications and other therapeutic measures that will be put in place that will be outlined depending on individual needs, all right? So this medication, one may ask, these stimulant drugs that are given usually makes one to get excited, but this child is already hyper excited and hyperactive, so why give such medication? So the reason is this, their hyperactivity is sort of a compensatory way for the brain. The brain is sort of trying to overact to stimulate this part of the brain that is hypofunctioning to begin to act. All right, so but when you now give these stimulant drugs that will now cause higher production or more required production of the neurotransmitters, of the hormones that the brain needs, all right? So when there's a better production, you see everything calming down. So the parts of the brain that are sort of acting up because one part of the brain is not functioning appropriately, they calm down.
They calm down because the hormone is now available.
It's now available.
Now, do these symptoms reduce with age, or they remain at that same level?
In majority of cases, it reduces with age, particularly if treatment has been instituted on time, all right?
Okay, you said treatment on time. Do you have a time limit? Maybe somebody has ADHD, discovered at the age of 5, and it's not attended to, maybe until the person is in his 30s. Is there hope for such a person? Because this is like late response.
Okay, well, there is hope, but there would have been a lot of complications that would have been avoided if treatment was started earlier.
What do these complications look like?
For example, the inattention makes it difficult for them to sit down long enough to be able to learn. So there's low educational attainment. There's also poor occupational attainment, okay, because they can't complete tasks. And then there's higher risk of other mental health disorders probably coming in, depression, anxiety, comorbidities, use of psychoactive substances to cope, and the like, Hang
on, psychoactive substances.
Yeah.
Is this person aware that he has a problem as a child? Does it affect them?
It does affect them, because it's not like they want to be naughty, in quotes. It's not like...
Okay, so it's like everybody's misunderstanding me.
They can't help, acting the way they are acting.
Okay.
But internally, they would really like to be that quietly seated child that you want them to be. But the brain is just acting in a different way. So hitting them or spanking them will not solve the situation. Most of the time, it could even worsen the situation. The child could start throwing tantrums and things. So it's not like the regular child who is being naughty and you spank and get the child to sit at a place because they're afraid of a punishment. So using that approach in these children may not be helpful. They recognize that there is an issue, and so they may want to cope using psychoactive substances because they know that they are pissing people off, people are upset with them, they're not getting along with things, they're being punished a lot, and they still cannot control those behaviors that they are exhibiting.
Wow.
Without help.
Okay, we'll talk about the help when we come back, but we're going on a short break. Please stay with us, we're going on a break. Welcome back. This is Health Matters, and attention deficit hyperactivity disorder, ADHD for short, is what we are discussing with Dr. Ege Barra. This is the time that you can call 0808-054-2233 if you have a question on the topic. You can also tweet at CTV_Mary A or send email moalale@channelstv.com. We're expecting your messages. We were talking about help for this child who seems to be trapped in his own world. They don't understand why he's behaving the way he does, but he can't help it. You spoke about giving some medication, you know, and that they respond very well and everything. But do they always have to use medication?
Majority of cases would require medication, you know, and that's why I said it depends on individual needs. So the child needs to be assessed, but there are other modalities of treatment like psychotherapy, you know, and the parents will need, you know, some sort of psychotherapy as well to help them.
You have to talk to the parents too?
Oh, definitely, to help them cope with the situation.
I would have thought that the parents will be the one to talk to the child once they know this is the problem.
Yeah, so they need to be educated on their appropriate
Let's take Ada
ways.
from Plateau State. Hello, Ada. What's your question?
Hello. Good afternoon, Mary and the doctor, Dr. Gebara. Ada calling from just Plateau State. From what she is discussing, it looks as if I don't know whether it's the same thing as autism, because that's what they said. They diagnosed them, and they are restless. You know, they don't finish any task. They turn everything upside down in the class. In fact, I don't know, they're uncontrollable. So my question is it the same thing as autism? Is this another name for an autistic child?
Excellent. Thank you very much, Ada. So she's wanting to know, is this the same thing as autism? Because in her experience, the autistic child does just about the same thing.
They're not exactly the same thing. Both are two different types of neurodevelopmental disorders that are commonly seen in children. The autism spectrum disorders, however, you know, it's got to do with poor development in language skills, social skills, learning abilities as well. But in ADHD, the hallmark is, you know, the hyperactivity and the inattention. But the two could actually coexist in one person.
Oh, so this is the comorbidity we're talking
there
about.
Could be comorbidity.
But that would be bad. Autism and ADHD?
It does coexist sometimes. So when the proper diagnosis is made, you know, then the proper management plan could be put in place. So they are not the same. They are two different disorders, but they are both neurodevelopmental disorders, and they are seen more commonly in childhood.
All right. Yusuf has a question for us. Yusuf is calling from Lagos. What's your question?
From Lagos. Yes, I want to ask the doctor, does taking sugary things make children to be in that condition? Does it, you know, predispose to that condition? Thank you.
Thank you. He took that right out of my mouth. You know, there's some children, you give them soft drinks and they're hopping all over the place. Does this contribute?
Well, we've already talked about what could be the causes, you know, and it's mainly at the developmental stage that the damage is done to a particular part of the brain. But there have been some dietary advices that could reduce the intensity of the symptoms, okay? Though there isn't one particular sort of food that you should say, oh, let this child take it. Once this child takes this meal, then the symptoms wouldn't be there. So the general advice is to have a healthy meal, you know, fruits, vegetables, whole grains, healthy fatty acids like omega-3 that you see in tuna and salmon, fish, and all of that. And it's also wise to avoid, you know, all these too overly processed foods that contain a lot of sugars, you know, a lot of additives, a lot of colorings, you know, as much as possible.
Do colorings give a problem?
Well, they pose health risks, not just to these children, but generally.
But everybody, really, everybody.
Yeah.
I see.
So the healthier the meals, the more likelihood the intensity of the symptoms will be reduced.
Okay, so are you at this point, from what you've been saying so far, because we want to alert a person who probably has such a child, that don't hit the child yet. Let's find out what's wrong with him. Are you saying that parents should watch the child long enough, 6 months
at least,
and watch him in 2 settings and make sure these things are consistent in 2 settings before they come to the doctor?
Well, those are part of the ways to guidelines towards making a diagnosis. Then there could be further assessment. For example, trying to rule out that there are no issues with the thyroid gland, because when there is hyperthyroidism, that means excessive production of some thyroid hormones, it could also present with some of the symptoms. So some of those investigations are done, but it's not like there's any laboratory test that needs to be done to make the diagnosis. There is no MRI or imaging of the brain that is required.
Okay.
Once these symptoms are there for up to 6 months in up to 2 settings, they are not age appropriate and they impair functioning, then that diagnosis is likely and the parent should seek professional help.
You've taken us into the world of a child who cannot help himself, but is having these problems, and probably how sad the child must be feeling. You take us into the life and the world of an adult who was never attended to. But before we do that, let me give Clara a chance to ask a question. Hello, Clara, what's your question?
I have a granddaughter, very hyperactive. 7 years old. He doesn't have any illness, but just being hyperactive. He's always wanting to do one thing or the other, always touching whatever, comes. And so I don't know whether it's the same thing with
ADHD.
I don't know whether it's the same
ADHD. All right, we'll let the doctor tackle that.
Well, one will need to put it into context, okay? Is that child usually just hyperactive when at home? Has there been reports from the school? Does it interfere with normal functioning? Because for the ADHD child, the hyperactivity makes them not to be productive. So they're not able to complete tasks. They come off as disorganized a lot of the time. So if it's just a child who is hyperactive, but is able to complete tasks, is able to get along, is able to follow instructions, is not likely. But if they still have other concerns, they could still see a professional for full assessment.
If somebody comes to you before 6 months, will you still be happy to attend to the child?
Yes.
Some people really get anxious.
No, definitely. If they feel they can't wait, when they've started observing these signs and symptoms, if they can't wait for 6 months, they could still come for help. And, further assessment could actually help one to, ascertain what direction to take.
So take us into the world of an adult who has had ADHD all his life, hasn't been treated or managed. What is it like?
Well, for that child, for the adult now, probably he or she would not have been able to attain educational achievements to the level that they would have if they had earlier treatments, so that they'll be able to sit down long enough to be able to absorb what is being taught. And then that adult probably will be struggling to complete certain tasks.
Or maybe even keep a job?
Even keep a job, because, they're not able to complete tasks. That's just it. The attention span is so short. To sit down in one place and focus in order to get certain tasks completed is an issue. So they'll probably be having issues of underproductivity at work. But the thing is, usually these symptoms reduce as they get older. It may not be as intense as it was in childhood. And that's why sometimes you have the ADD, which is the attention deficit disorder. Is not...
The hyperactivity is gone from there.
The hyperactivity is not there. So the hyperactivity aspect may be reduced as they get older, and that's why the ADD is seen more commonly in adults.
I see.
But
could it be because they are old and less active? By reason of age?
Yeah, it could be. It could also be that, somehow the body is learning how to sort of begin to heal itself, okay? But it's not really recommended to not have it attended to.
Definitely.
And
not.
assume that an individual can outgrow it, because it could cause a lot of frustrations on that
and
individual
like you said, turning
along the
to
line.
psychoactive substances
To cope. Having depression and anxiety as comorbidities, so the best thing is to seek therapy as early as possible. So there are other ways, there are other forms of helping the child to adjust besides use of the medications that we've talked about. With the psychotherapy, the child could be trained on how to complete short-term goals, because it's usually when the goal is protracted that they find it difficult to follow through. And they not being able to follow through is also frustrating for the child.
So they teach him in bits.
Yeah.
But we're going to have to stop now. Thank you so much, Dr. Egegbara, for coming to the show. It's been wonderful having you and learning all these things. Thank you.
My pleasure.
Thank you very much for being with us from your home, your office, wherever. And thank you so much for calling in, Ada, Yusuf, and Clara. Have a wonderful day, everybody. I am Mary Alale Yusuf.